The public health infrastructure grant for us has been something that has not only prepared us for today, but also is helping us prepare better for the future. Our programs at the health department prior to PHIG funding were sort of in a silo. The programs kind of operated in a fashion where, this is my role, this is what I'm contributing, and this is how, I'm going to move forward with my public health career. So in a place like the clinic, where people come to the clinic for various different things, immunizations, overseas travel, and all sorts of things. Those individuals would come for appointments and things like that, and they would get seen for those very specific things, and then doing follow-up surveys and that sort of thing. We'd learned that those patients always have more needs and more things that could have been addressed, with just a referral or some sort of engagement, through the process. And for a long time, being in population health-based care, our focus is to see the patient, see as many patients as we can see, and which we're doing pretty good at, but learned along the way that certain things we could cover better. So we conducted the workforce training assessment using PHIG funds, which gave us a ton of context and behind the scenes and answers into some of the things that patients had indicated to us through their different experiences through surveys and stuff like that. And with that assessment, we determined that we needed to create a quality improvement council. And the point of that council is for our team, leadership team, management team, and also the patient comments to bring all of that together and figure out what projects do we need to take on as a health department to make providing patient care to high volumes of people better. One of the projects we did was a clinical flow project, and in that project we were trying to determine what things are we potentially missing when patients come through the door. And through that project we learned that the patients have some of them have literacy issues. Some of them don't understand the point and the purpose of the paperwork and the questions, and some of them simply just kind of wander off and kind of get lost in the building and the clinic a little bit. So we were trying to come up with a way and an idea to bring all that back together and make sure that the patient is getting the most out of their experience. One of the things we did was hire patient navigators to help patients navigate our system when they come to the health department. If you have a person that has literacy issues or don't understand what all the services and things that they can get when they come to a health department, it makes the process smoother if someone can engage them in that lobby and have that conversation with them before they get back to see a nurse or see a family planning doctor for services there. A lot of times when patients get back into those appointments, that's when they want to ask a lot of those types of questions, which creates a backlog for us. So bringing those patient navigators in and connecting patients to services like housing assistance, applying for SNAP benefits, food boxes, and those sorts of things in advance, and giving them those different points of contacts really helps the clinic. One of the things we noticed immediately was that we were able to double the amount of patients that we can see in a day, being able to open up more appointments because we're meeting more needs when patients come into the door rather than they get back for an appointment and a 15-minute immunization turns into a 45-minute conversation about how to get access to WIC and community health workers, or maybe even a question for an epidemiologist. Having that patient navigator in the lobby to address a lot of those questions, and give out a business card or point to a flyer with a QR code that they can scan, or show them where we post health department updates on the website, or show them the billboard. All of those sorts of navigation tools has helped us to be able to get through our appointments on time, which allowed us to open up more. It's very important to make sure that the community knows that you're doing the things that you need to do to try to provide them with the services that they need. Being a public health organization, we want to be that safety net for the community, and a lot of our clients and patients are underinsured, don't have any income or low income, or live in impoverished situations and do things like take public transportation or ride bikes or walk to health department locations. A lot of times they go a very long way or have to go through some things to get to the health department, like finding a babysitter, taking time off from a job that pays them hourly, and when they're not there, they're not getting paid. So, it's very important for us to not only be able to provide the services that we're offering to them, but also be able to make sure that they maximize every minute that they're in the health department. Just because that person was able to take off from work for this particular visit doesn't mean that when they have a need in a month or 2 months that the circumstances and the situation will be the same. And we understand that. We take that into account and really try to connect our patients to as many services and resources as we can.